There we go. Starting. Now okay. There we go. Now it's a lot better. Hello, everyone. Welcome to the Champagne Wishes full podcast with me, Brian Bilbao, and I'm here with somebody that I guess you could say is very well in the psychiatric world. He's a very great guy, very good at his craft. Dr. Adharsh Sahadevan. Say hello, Dr. Sahadevan.
Hi, Brian. How are you
Hello.
today? And
Good. How are you
thank you
doing?
for this opportunity. I'm doing very well, thank you.
No other psychiatrist I want on here, I'll tell you. But Dr. Sahadevan joins me. He's a psychiatrist, as I said. He has fellowship in geriatric psychiatry and has a master's in public health. Dr. Sahadevan, before we get started or anything, do you want to give us a brief little overview? How long have you been doing psychiatry? Have you always done psychiatry? Or were you always around here? Where have you practiced? Stuff like that.
Yeah, I did my residency from El Paso, Texas Tech. Completed that I did that from 2008 to 2012, and then did my fellowship in geriatric psychiatry. I was at Wayne State University. And actually, before going into residency, I did my master's in public health for 2 years.
Nice.
That was from Wichita.
Oh,
and
very
I've been practicing since 2013.
Very nice. What made you prefer, I guess, specialize with the geriatric population? Was there anything specific, or was it just random?
I think I have an interest in cognitive research and how the brain works. So there's two ways you can do it: either study children or the older population.
So you went with the old population. There you go.
That's right. So I decided to go for the older population.
Very good. Like I said, thank you again for joining me and everyone that's listening. You know everything going on in the world right now, the major pandemic, the coronavirus, COVID-19. I guess you could say I saw on MSNBC actually right before we came on here. They were speaking with the CDC and all that stuff. As of right now, globally, 615,000 cases approximately, 28,500 deaths. And in the U.S. alone, we have 112,000 out of that 615,000. And we're near 2,000 deaths. Probably by the time people see this, we'll probably reach the 2,000 mark plus. So I guess give me an overview about you. When was the first time you started hearing about the virus, and when you started saying, hey, this might be a serious kind of thing, we should probably give it more of the respect that we're not kind of giving it as people weren't doing the last few months?
Yeah, I think we discussed this when the reports came out from China, that there were a lot of people coming in to the hospitals with pneumonia. And there were warning signs with the number of cases that they were not able to handle it. So I think a lot of people downplayed it. It was not given the kind of importance it should have been given that early on. Or maybe it was spreading too fast, before we could evolve and make policies.
Right. Do you think, from your medical background and stuff like that, this was bound to happen? People were saying this was a surprise, but if you think about how much traveling there is in the world now, how easily accessible it is to get on a plane and go, do you think in a way that we knew this was coming, but we just never wanted to believe it? Does that make sense?
Yes. Now, the problem with pandemics is it always happens when you least, you could say we're going to expect this at certain amount of time, and you could be wrong with it. Right. So there's no way to predict when it's going to be out of control, and it's going to be hard for the health authorities to actually step in and do more, or get an idea of what's happening also. So it's really unpredictable.
Really unpredictable. Yeah, that makes sense, because everyone keeps saying too it shares kind of like the last major pandemic, the 1918 Spanish flu, right? It was just a few people that turned out to be, I think it was 50 million deaths overall, which is crazy. It was a quarter of the population almost. Do you think, even though this does affect immunocompromised specifically and more of the geriatric type populations, do you think we're going to reach high death tolls like that? Probably not, right? Or do you think we could?
Again, it's a very fluid situation.
Right.
And what we are trying to do right now is buy more time. So we have, the necessary equipment, probably race against the virus to create vaccines or medications. But at this time, we cannot really say we are going to, take control over this. And time is a big factor, because the virus, as you can see, has the advantage.
Yeah. Do you think that we've been moving too slow as a country? How everybody was saying we should have locked down weeks ago, months ago. Do you think we're on pace to stop this, or do you think we could have done more? Does that make sense?
Yes. And now I think we are right on track with that, because there's no way to shut down the whole system early on when you have one or two cases, and that's not warranted. So for
Right.
every pandemic, they have, what to do when it reaches a certain amount of cases. Give you an example. They have outlines for flu. When you have less than 90,000 is when you take these precautions. As it stretches, then you would be more careful and you would say a restriction of movement, what you want to do at the hospital. So there's actually guidelines for that.
That makes sense. So I know we discussed prior, obviously, for the last few weeks, especially you have a brother out in Italy, and obviously their situation's kind of dire and very emergent. Anything about that? Like, what did you think about the Italy unfolding situation?
I think they didn't take it so seriously as to how it's going to evolve.
Mm-hmm.
And I was talking to my brother. It really spread that fast, really quick, and they have a lot of older population because it seems that a lot of people want to settle in Italy for the, wanting it's for the religious importance. A lot of people want to settle down in that region, Rome being there and Vatican being there. The other part is the closeness of the community. Everyone is so friendly. They get to the weather is very good. So it's almost like Florida for us when people go and settle down in their old age.
That's actually a really good analogy. Yeah.
That's right. So they are likely to be, more affected by the virus.
Okay. Is it true? Like, I don't know if you could attest to this too, because your brother's out there. Everyone also was stating, like, oh, well, Italy's very olden in terms of like their technology and like the way they are. Is that like how their medical community is too? Like they're kind of backtracked as compared to how we are in the United States or other countries?
I don't think that is as much true. I mean,
No.
they say they have a very good public health system. Now, the problem there is the virus when it takes over and it develops into what we call this acute respiratory distress syndrome, the ARDS, and it's almost similar to pneumonia. People come in with shortness of breath.
Right.
Older people are more likely to be affected with those symptoms, and you need more ventilators. Right. So if you have an older population, you're having more complications, which means you need more ventilators.
Yeah.
And no hospital is going to be no hospital, no matter what, no country is going to be prepared with ventilators.
That makes sense. It's really sad too. Like I saw videos and stuff. Like you said, they're running out of just anything, any type of equipment down there, and that's why there's so many people dying because they can't even fit them in a bed, let alone giving them proper life-sustaining devices like a ventilator or whatnot, which is sad.
That's right.
So, well, thank you for that. I think that was a question because you said you had that brother out there, so I was like, it'd be a good thing to maybe talk about that a little. But I guess, what is your basic definition? I guess if we could talk to people about like the etiology or the pathology behind the coronavirus, COVID-19.
Yes. So the belief is, it's almost certain that it has a zoonotic disease, which means it jumped from an animal to the humans. So that is why we are not really prepared immunity-wise for this virus. It takes time for the human population to build the immunity. The animal they suspect is the bat. And there's also belief that it probably went into pangolins at some point, but majority are with the consensus that it came from a bat.
And can you attest to that it's not man-made? It's not a bioweapon used for terroristic warfare?
Yes. So there's a lot of conspiracy theories, but people have done genetic analysis, and they're saying that there's no evidence that it is created. They're almost sure and it belongs to the coronavirus family. So that's why it's named that way.
Listen, some of those theories are pretty scary. Some people are dead set that, nope, this was by China. They're trying to wipe out the excess in our population. And some of them are pretty fun to read, I'll tell you that much. So if you're ever bored, there's a ton of them out there. But no, thank you. That was good. Have you heard of any medications or treatments thus far as being effective? I heard of something, it was like some family within the sulfa drugs and like a Z-Pack. But when I did more research on it, that study was only done on like 30 people in France. So it's still new, and the case study was very small. It was very limited. And I was saying if you're allergic, like I'm allergic to sulfa drugs, so I would be ruled out from using that exact drug. If you're allergic to Z-Packs, I'm assuming you can't use that process either. I don't know if you heard about this treatment protocol or if you know of any, but I guess that's something I was wondering too.
Yes, you're right. I heard about that study that came out from France. and their population was very small. You're right. It's
Yeah.
very small to say that it's going to work for sure. So none of the treatments that have been out there, and what they're saying is they don't have evidence to say this is going to be effective.
Right.
But there's a few medications that are being tested, and you're right with the Z-Pack. The other one is the chloroquine, hydroxychloroquine.
Right.
And then they have a few antivirals in trials. But nothing has proven effective. So there's no way to say that, this is going to work.
So the cultivation of these two drugs, right? These two drugs being mixed up, is this really just to alleviate symptoms or to help like alleviate the disease process? That's what I'm confused with, because nobody's really saying what these two drugs are really doing.
That's right. So there is no real information as to what
They're
they're
right.
doing. So now the only reason that they're using is, so it's almost like compassionate care, when somebody, is so desperate and it's not going well, the prognosis looks bad, you might as well try a few things that people are saying works. And if it does, it's good. So
Right.
that's the only reason that has to be used. It has to be used now.
I got you. All right. Well, thanks for answering the medical part. I know it might have been, fun researching this stuff. I want to get into what you specialize in, the world of psych and all this stuff. So
Yes.
what did you, I'm assuming you probably had a field day when everybody, the media, the people started freaking out. What did you think about that when people started buying toilet paper, buying everything out of the shelves at Walmart's, other super convenience stores? Did you think there was a right for this to happen? Do you think people were overreacting? What was your take on this?
No, I don't think it was overreacting. So let's understand this better. It is classified as a disaster, natural disaster. So any natural disaster, people are bound to panic or be anxious. Now, how they understand this and how they react to this is going to be on their ability to understand the situation. So some people, there's a lot of talk about people buying toilet paper and they say it's unwanted. Obviously, it is unwanted. How is it going to help with the situation in a virus that's affecting your upper respiratory tract?
Right.
The problem is we don't understand is how it might be emotionally soothing to them. I've talked to a few doctors. They say they feel that if things come to an end, there might be some dignity in the way things end. So they don't want to run short on supplies. So it's kind of soothing to them. The other part is not everyone hoards. If you look at the majority of the people, it's they are not into hoarding. A few probably do because they might run short on supplies. Let's say if they're older people and they don't have anybody to help them. Mm-hmm. So they might be taking more supplies than what they need. And again, there's no justification to taking like a whole cart of milk or a whole cart of chicken.
It's a bit excessive. You know what I mean?
That's right. And going back to your question on the hoarding part, sometimes we also don't understand some of them actually have mental health issues.
Right.
When they react. So they don't have the ability to understand the whole process. So that's what they think, maybe I'll run out of food, so I just want to save up. Now, yes, so you're right. The hoarding is not justified at this point. Everything is running fine. There's, adequate truckers and produce and everything is there.
Right. So I guess like in terms of your realm, the psychiatric realm, if somebody never presented with a hoarding disorder, but now they're like, I'm stocking up like a zombie apocalypse, I'm getting 12 rolls of toilet, like every day they're buying this stuff. Is it possible for you to diagnose now a hoarding disorder, or no, because this is a natural disaster, you kind of had to let it go unless they did have previous symptomology, I guess, regarding this? Like, does that make sense?
That's right. And sometimes it's almost like a shared problem. Like I've seen people, they take a few things and then they see the other person takes that and they say, oh, I might need this, or I might not run out of this.
Right.
And they tend to take that too. I don't think it's a disorder. It's because just there's a poor understanding of what the situation is.
Okay. So that makes sense. So I feel like, because I think I saw somebody post on a social media account recently, like, do I have a hoarding disorder or something? Like, should I get checked out? And I thought it was funny because if you think about it, most people, not everybody, but most people are literally grabbing anything they can, especially if it's canned, toilet papers, hand sanitizer, gloves. So that's a good way to put it then.
Yeah. Now,
Do you,
again, one more important thing I want to press on this is like you should not be stressed. I mean, however you can do it,
right.
you know, you have to bring down your level of stress, because keep in mind, if you tend to panic about the situation, your immunity is going to go down,
Right.
and the more stressed you stay, your immunity, it affects your immunity. So
I
it
was say the
doesn't.
cortisol levels, right?
That's
Cortisol
right.
affects, your immunity.
That's right. So it doesn't help you fight the disease in any way if you're too stressed. So you have to find ways to bring it down. However it works. Maybe exercise, meditate, and also they have done studies in animals. They found that the virus shedding is more when the animal is stressed. So they think in all these animal markets where they believe it came out from, those animals were kept in cages and they see what's going on. With their partners in the cages, they're slaughtered. So
Right.
and that's when the maximum virus shedding happens.
That's crazy to think about. Wow.
Yeah. So you want to decrease the stress levels.
Definitely. So do you think in a way, how do you think the social media, the news has been portraying the coronavirus? Do you think that they've been instilling fear like subsequently, or they have been doing it purposefully? Do you think it's a good thing, bad thing?
So, okay, again, there's two sides to it. So you want to look at the information that's accurate, what's coming from CDC, what's coming from the official channels, because they're trying to help you. You don't want any kind of misinformation, like, something is going to end, those kind of misinformation doesn't help. The media, yes, definitely. But you don't want to keep watching the news all the time, because that's going to increase your stress. If you watch 24 hours updates on how many people died, it's not going to help you anyway.
Oh my gosh. Because I feel like that's a big thing. I feel like people, if they didn't have anxiety before, are starting to get it now, because everyone just talks about the fatality rate, how many people are getting confirmed, and then, the little, the little ratio between confirmed and death. And I feel like you said, they're sticking too close to the numbers instead of actually just living their own life and just trying to protect themselves. Do you think that people that didn't have anxiety, for example, this will now cause an anxiety disorder to develop? Because like you said, this was a natural disaster that nobody really expected. And I'm assuming it might be not even just for now, but maybe a PTSD, an anxiety related disorder may occur now because maybe a loved one died, or maybe they did get corona and they were really sick and came back. I guess maybe touch upon that.
That's right. So the whole, when that happens, for the whole community, the stress level is going to go up. So there's going to be some level of anxiety. And you'll see that within healthcare workers, because there's no clear policy. You'll see a shortage of staff. You'll see shortage of equipment. They have their anxiety. People, when they hear this, they get more anxious because they don't know how they're going to be treated in the hospital.
Right.
So some amount of it is true, but to overly think about it, it's not going to help you. Because if you think too much about it all day, it's just going to increase your stress levels. All right. What was the second question?
Oh, so the second question was pretty much, do you think if they're getting anxious, right? I'm thinking of like another anxiety related source, like PTSD. What if somebody they know got corona, maybe a family member, and they passed away from it, or they got corona, they got very sick and they recovered, but now they're always terrified. Oh my God, if I get another virus, I might die, or like, look what happened to me in 2020. You know what I mean? Can PTSD develop as well because of this?
Yeah. Yes. The answer to the question is PTSD can develop, and they can meet criteria because it's a natural disaster. So, and this is an unusual occurrence. How things are. It's not your normal pattern of life. Things have shut down. The way you live, everything has changed. So, a lot of people will actually meet criteria for PTSD if it is very traumatic for them.
So, I guess that was a good little transition that you brought up. So, what do you say? Because you were kind of saying before, don't watch the news all day. But unfortunately, for a lot of people, we are now stuck in our houses to quarantine. And we go from working maybe like a 9 to 5 job, maybe if you have kids, picking them up after school, going to the gym, and then, eating dinner, then going to sleep. Now all of that's thrown off. and now we don't know what to do with ourselves. That maybe that's why we watch the news. So how do you combat that, what you were saying, to not just watch the news? And what do you do with your day now that you lost all structure and you lost, I guess, a routine that you were so vigorous and so, you know?
Yeah. Try to keep things as normal as you can. So by that I mean, if you're working, try to engage in work. I know a lot of it is now with the social distancing. You have to be, it has to be through online
Yeah.
activities. Yeah. So try to keep that engaged, because work by itself will engage your mind and reduce
Right.
the stress. Go for walks. If you have a partner, you can walk with a partner, but keep it limited to two people or less,
Right.
just by yourself. Um, talk to friends. Talk to friends. Watch things that you like.
Mm,
I usually recommend humor, because at
mm,
times humor helps. Uh,
definitely.
and then, other things like what your spiritual practices. Definitely, it calms you down. It's a means of support. Call family and find out if they're older, if they're doing well, because keep in mind they are likely to be stressed. How things are evolving.
Right.
Talk to children, and tell them how the situation is, why they don't go to school, and why they cannot play with their friends as much. So yeah,
Do you
understanding is helps.
do you think when explaining to a child, kind of like many things in life, whether it's the birds and the bees talk, stuff like that, should you be as detailed as possible when explaining the pandemic, like translating into their words, obviously? Or could that provoke anxiety, like a trauma, if they learned if you go outside and touch, like, I don't know, something wrong and wipe it on your face, you have the potentiality to develop. Do you know what I mean? Like, is saying too much a bad thing when it comes to kids?
No, I mean, they should have an understanding why we are taking the precautions, but you don't want to scare them also. You don't want to scare
Right.
them as in, like, sometimes they start imagining. So you don't want them to
Right.
imagine as to like ghosts and
A
zombies and
big
all
man monster or something, this
that.
coronavirus is, yeah.
Exactly. So you don't want to take them to that level. Just tell them it's a sickness, you get sick, you'll be in the hospital, the regular things.
So then going off to what you were saying too, like the elderly, the geriatric population, stuff like that. Without breaking HIPAA, obviously, I had a phone call at our crisis center. I think it was about a few days ago, and pretty much they were stating they were maybe like in their 70s, somewhere around there, but that they don't know what to do, and they were saying that they don't want to harm themselves, nothing, but they're afraid to leave their house because they're afraid if they go outside. I think they said they had like two comorbidities.
Mhm.
They have like severe asthma and they're just worried. And I think there's no reason for them not to be worried because if they do contract the virus, they have unfortunately a higher risk of fatality as compared to you, me, or someone who may seem, normal. So how do you then deal with that? Somebody who doesn't want to leave their home because they actually are of elderly age and have, I guess, immunocompromised systems.
Mhm. So you would tell them to be more cautious, because definitely there's a risk. You don't want them to go out and be as active as before, but still be active in their neighborhood or maybe near their house. They can walk, they can walk with their partner. Also, talk to their family regularly. The key is they don't want to be isolated, because people are anxious about talking to them about this. No, you can tell them, what's happening. Sometimes they're also worried about getting their own daily needs, things like groceries. So you can help them with that, deliver it to them so they don't have to go out.
Right,
Um, Again, the same things, how to take your mind off this subject so
right,
that you're not just thinking about this 24/7.
right. So if you were to visit them, right? Like I have an elderly grandmother. She's very immunocompromised. She has extreme diabetes, congestive heart failure, and like a ton of other things, right? With my family, we're like afraid, and this probably goes on with other people of similar nature too, or ideologies. Do we just practice safe social distancing? Like we come from a Uruguayan background, like I told you, and it's all about kissing and
That,
hugging. But we can't do that, I'm
that,
assuming now, just because of the risk, right? Or
yes.
is there, yeah,
No, yeah, it's better to practice social distancing. You can visit them, but stay 6 feet,
feet?
away from and talk to them, see how they're doing. Yeah, try to visit. Definitely visit them. I wouldn't say
Right.
because
Just don't see them at all, right? Yeah.
That's right.
Okay.
Yeah.
So I guess have you, I guess, in your work, obviously psychiatrics, I don't know, have you with how much ever you could disclose, because obviously HIPAA is a real thing.
That's right.
Have you seen anybody with, I guess, a confirmed case of coronavirus?
No, as of now, it's a no. But we do have cases in the hospital. Yeah.
How would
So
you, I guess, let's say you met up with a patient, let's say they were like 50 years old, bordering the line of geriatric. Maybe they have, I don't know, let's say severe asthma or COPD. They're immunocompromised and they're stating to you like, oh, I don't know what to do. Like they're kind of very anxious. They have racing thoughts, not suicidal, but they're just getting very nervous. Like if I get this, I'm going to die. What would your treatment plan be or your protocol? How would you assess them? I guess, what would you tell them? Would you prescribe them something? I guess, give us like a thorough thought process you would do, I guess, on a patient like that.
yeah, definitely for the anxiety, if it seems to be beyond what it should be for that situation, we can help with the anxiety with medications or therapy. But there is also some reality to it. If they're positive and they have multiple risk factors, then they should get help. They should be evaluated by the primary care physician, or if not, if they think when you mentioned if they have shortness of breath, definitely that's a criteria for hospitalization at this point. Again, that is the expertise of the hospitalist.
That makes sense. So do you think now, I don't know if you've seen a dramatic rise maybe in your clientele, or do you expect to see an increase in people that may start using or utilizing your services now because of everything going on and how severe things are getting?
At this point, it has not reached there because we are
No.
so early in the phase. It's only a week.
We haven't even peaked yet, right?
That's
Not
right.
even close. No.
And it's definitely a possibility because people are going to sit at home. And even for a normal person to be isolated for a few weeks inside their home, it's going to be very stressful. So, yeah, and I don't want to speculate on these things, but I think there's definitely, and there is evidence of, issues like anxiety and depression going up after a natural disaster. So I presume it's going to be the same way.
Yeah. So what do you think about like mass hysteria? So like people losing their minds and stuff like that? Because like we were even kind of saying before, people aren't used to just sitting at home, being isolated, not doing their daily routines. Do you suspect that maybe people can start not literally losing their minds, but acting different, changing like their ways and stuff like that, and maybe acting a bit more violent, or maybe going out in public and doing bizarre things that they never done before because of all these rapid changes in such little time?
Yes. I wouldn't term that as mass hysteria, but there can be significant changes, especially when the society goes through this. Yeah. And the escalation to that point depends on how much law and order can be maintained, as well as other services. So when I mentioned about people hoarding, that the services are running fine. I mean, the groceries are coming in, it's being restocked, the medicines are there, everything is working fine. The problem arises when there is an unpredictable and rapid change in the events. Okay, and there is multiple conspiracy theories, inadequate resources. That's key to this. Loss of faith in leaders, and the other thing, usually what happens is significant death in population, and which also includes children. That is going to upset, a lot
of people.
A lot of people.
Yeah. So do you think when it comes to like government officials and stuff like that, and I'm not asking for like, what you support or who you're for, stuff like that, but the first example I have for you is like the police stations. I don't know if you heard, but certain police departments put out like, we're not responding to calls unless they're immediately emergent. Please don't bother us, stuff like that. Do you think that was a good message to post out there? Because wouldn't that kind of let deviants, I guess, people of who don't really mind what society thinks to go and do whatever they want to do?
Yeah, that, it's always a possibility, especially in a situation like that. People can take advantage of that. I'm saying, crimes happen, but I think they're doing that for the benefit of the society, so they can attend to who the most need is at that
Needed.
point.
Right. So then I guess my next follow-up question is, I don't know if you've heard, most likely, but like Donald Trump, for example, our president, refers to the coronavirus as the Chinese virus. Actually, it's funny, it would just happened 2 days ago. Our school sent out a massive email because I guess a girl in one of the programs at my school at Penn College got like bullied or something, and it made like global news in like China. But he was very xenophobic. He was very negative towards the Chinese culture. I won't say what he said, but he was very derogatory terms. What do you think about our leader, I guess, too, like calling this virus the Chinese virus because it stemmed from China, and how, I guess, people have become racist towards the Chinese culture because of this? How do you combat those ideologies, I guess, or, you know?
Mhm. Now, what's happened is, I'm not going to say it shouldn't be a political statement.
Right.
Viruses have been named after where they've been found, okay,
Right.
and that's been the norm. But at this point, it's evolving into something that people might harm somebody else just because they think the virus came from there.
Yeah.
And so the issue is not everyone takes it in the sense. So in a scientific community, you can say this. I'll give you an example. There's a virus that came from a village in India, and it's named after that place.
Yeah.
So, but nobody's going to attack them just because the virus came from there.
Right.
Okay, so people have to understand that. That's the only purpose of naming the virus that way.
Right. And
it's being
sorry, keep
changed.
going.
Yeah, it's being changed. The naming system is being changed so that somebody who acts out emotionally is not going to do that, because they're not going to use their cognitive part to understand what it means.
Right.
It doesn't make sense. Yeah.
No,
So
it
it's
doesn't.
not right. And definitely there shouldn't. Nobody should be attacked for any reason in that way, just because an illness comes from a certain location, because everyone is susceptible. It could have evolved out of any place, and it's the same thing.
Why do you think people put blame, like they just, oh, it's from China? So why do you think they act out and act so aggressive towards these people? Because they actually think it's from there? Or do you think there's some hidden sublimating thing that we don't know about that they have towards these people, like these racist gestures? Like, is there an underlying issue? Like,
Yeah, I mean, it's usually, people have a lot of beliefs, and when things align with their beliefs, they can act in certain strange, unrealistic ways. So I don't think it has to do with the majority of the population. One person can do something in a store, and that doesn't represent the whole culture of the whole, place.
right.
Does make sense? But definitely,
No, it does make sense.
Yeah. So I agree. I mean, it shouldn't be named at this point, and I agree with the naming way. It should be COVID-19, because when you term it that way, it stigmatizes somebody.
It really
And
does.
they went for that. And that stigma can happen even in the community. I don't know if you, Brian, if you're aware, that you could say you're a healthcare worker, and people really don't want to be near you at this time.
Yeah. Especially now. Yeah. I can't even go to my own house without taking like 7 showers, and my mom has to make sure I took the shower.
So,
I can't even go to my girlfriend's house without her mom spraying me with disinfectant. I'll be like, "What are you doing?"
yeah. So those things, they really don't come out of a racial bias. Sometimes it's out of fear, and they really don't have an understanding of the fear right now.
So do you think that's what it is? It's not intended ignorance, but it's like accidental ignorance. They just don't actually know. They just think, oh, it's from China, so it's the Chinese virus. So all Chinese people. Does that make sense?
That's right. It's definitely out of ignorance.
Yeah.
That's
gotcha. Yeah, because I was telling somebody, I went to get Chinese food. I think it was like 2-3 weeks. It was before all the stuff shut down. And it was like maybe like 5 o'clock at night. And the lady told me I was the only person there the whole day. And I felt, I felt bad, but I said it had to have been stemmed from this, which is crazy to think about, that even people won't eat their food just because they're associated with the coronavirus starting in Wuhan, China. So,
yeah.
it's something, I guess, us he needs to be more knowledgeable about and just show more respect to. I agree with you on that aspect.
Yeah. Ignorance and fear is a very bad combination.
Yeah, yes, it is. It's a horrible combination. Something you don't want.
That's right.
Right. So I guess coming from your realm of practice as well, how can we ultimately control our thoughts and well-being? Like you were saying, walking, all that stuff. But what is your biggest, what do you do, let's say, like a psychiatrist? I feel like I don't know if anyone's ever asked you, like, what do you do, Dr. Sahadevan? Like, what have you been up to with all this mess going on?
Okay, so the best thing is to preach, practice what you preach.
Right.
So we talk about sleep hygiene, we talk about exercise, we talk about a healthy diet, meditative techniques. So that's what I encourage at my home. I don't force any of my children. Also, they're too young to understand.
If you don't sleep 8 hours, you're grounded. No ice cream.
Yeah. So those things are important. Activities. The key thing is activities. Right now, being at home, which you're more likely to sit and snack and binge on TV, which is not the greatest thing to do. So you want to make sure you're getting that activity that's required. Yeah, so those are the things I practice.
So what do you say then to people specifically that are like caregivers or have to like attend to their mother or father, but they're scared because they're healthcare workers, let's say, and they're afraid that if they go to their house, like I was saying to you before, how do you combat their anxieties? And if they did come to you, for example, would you start them with treatment? Would you just try to like de-escalate them and say everything's gonna be okay, just practice social distancing? Like, how do you deal with people who keep getting overwhelmed about everything happening?
I think you should talk to them so that they understand the reality. There's no way to predict how this illness is going to turn out. Maybe I don't know. It might have some kind of a medicine that's going to help. There might be more machines available to help people.
Right.
That's definitely in the works. And then what if there's going to be a vaccine? So right now we can only work with what we have, and that is the social distancing. So definitely meet them, but you just want to keep that distance. You say, I've come here to find out what's going on. Maybe sit 6 feet away, talk to them, and
do you think the fear that was instilled, I guess you could say, like we were saying originally with the media like minutes ago, do you think that this fear was actually a good thing though in a way? Because if people thought this was just like a virus, oh, wash your hands, we're done with it, whatever. Do you think that would have had more negative effects? Like, do you think the fear was actually a good thing? Because I see a lot more people hand washing, sanitizing, all that stuff.
Definitely. So it's more than fear. I would say it is caution. I would use the term caution because when you go into saying fear, you're actually avoiding a lot of things. It's almost like when you said they don't want to go anywhere near the hospital, even if they're sick, because that's fear. But caution is like you're doing everything so that you don't want to get sick.
Okay.
So, and you're doing everything. That's yes.
I got you. So a friend of mine, he's in pharmacy school. He was the one I sent you the question really late, but I thought he made a good point. He wanted me to ask you pretty much, what's your opinion on why people always for some reason choose emotion over fact? I mean, he even made the examples like vaccinations, vaxxing versus anti-vaccination parents, taking metavitamins, faith healers, chiropractors, Ayurvedic medications, homeopathy. And then he asked for a follow-up question, how do you think us healthcare professionals should address these patients?
I think we should encourage them and discuss with them the facts, because sometimes it's all what they know is they heard it from a person or they are close related. So you would discuss with them openly about what the situation is, what they can do. Definitely not take any medications that is not required. There's no proven medications as of now. But if they're asking about vitamins or some to boost up their immunity, that's fine. I mean, it's okay for them to take that. It's with their belief. If there's no harm to it, I'll give you an example. They'll say, okay, what about if I eat more fresh fruits and veggies and stay healthy? That's perfectly okay. You can do that, and you can.
Right.
Yeah, but you don't want to overdo it. Also, like take too much, thinking that it's going to cure all the viruses. No, that's not going to happen.
Because everything in excess is toxic. I was telling people. people. You could have a blueberry toxicity, or like if you eat too many vitamins, I think they said you could increase your chance for like cancer if you take them in excess, not regularly, but in excess.
That's right. So you don't want to go to extreme ways thinking that it's going to provide a shield or something. No.
I say you'll never get any ailment whatsoever for as long as you live. Yeah.
That's right. That's right.
So
Yeah.
so then, why is that reason, to go to his overall question? Why do people always rely on their emotional for fact? I mean, obviously that's very subjective, so there's really no definitive answer. But do you think
Yeah.
it's because it makes them feel comfortable? It makes them feel okay when they believe in something more emotional than it's factual?
I don't think that happens most of the time. It depends on their. It depends on their ability to understand things. You know, let's put it that in simplistic terms. I mean, it's more of their cognitive function. You know, when you start thinking, and does it look right? Are you able to rationalize these things? Does it make sense? Instead of blindly believing in certain things.
That makes sense.
Yeah.
Got you. So I guess what are your thoughts on the future with the coronavirus? I guess, do you think that it's going to get better? Like we were kind of foreshadowing before, we haven't even reached the peak. It's going to get worse before it gets better. That's what I keep saying, kind of, right? I don't know if you would agree.
Yeah, you're right about that. So it's going to get worse. So what they can do is look at the data. And Johns Hopkins has a very good website. It has a number of cases, how many people, are deceased, how many are recovering. The data is also, it shows graphs for each country. So you can see where the countries are going. And some countries, especially like Korea, where when we talk about flattening the curve, you can see how their curve is going. So it gives you some idea of how things are happening as of now. It is definitely going to peak and then come down. So everywhere people are working to bring that curve down. It might come in waves again until what we call as everyone gains the herd immunity. So pretty much everyone at some point is going to be like immune to coronavirus in some way, or there's some other change, a vaccine develops or something.
Right. So you think there's going to be a rebound? I think I was talking about it in my last video. Like eventually it'll go down, but then it's going to go right back. Because I, for some reason, think in the winter 2020, I feel like it's going to come back. I don't know why, but I feel like you were saying we're going to get it down, but then it's going to come back and it's going to go back up. Maybe not in this excess, but you know what I mean?
Yeah, so it does happen in waves. It does happen in waves, but you want to really control that initial surge, which is happening right now. And you want to be really prepared.
Yeah. So what do you have to say to the people constantly buying toilet paper or hand sanitizer or gloves? What would you say to them?
I don't think it's needed at this point for somebody who's sitting at home.
Okay.
You're not really going to expose yourself until, there's friends and family visiting constantly, or if they're traveling, or if it's and you don't need that. But in healthcare, yes. So if you're at the workplace, definitely you want to protect yourself and use as per the guidance.
Okay. And you're gonna give me some websites that I'll put down too in the YouTube article. Where are they usually? Are they all CDC related? Or are they, like you said, Johns Hopkins? Is that one of them?
Yes, there's the CDC website, the Johns Hopkins, to look at the graphs. It's not to worry about it so much, but to actually, give you more information.
Okay.
Because
Perfect.
at this point, there's no point in obsessing and being fearful. The third one is the one Apple came out today. So it's more like a question and answers to let you know what steps you want to take, and it's developed in guidance with CDC. So I think that's reasonable.
Okay. Awesome. So where do you think we're going to go from here in terms of medicine? Do you think now we're going to have a lot of more preventative, precautionary things now when it comes to screening patients? Because now we've had our first, in I guess you could say the modern era's type of pandemic. Do you think we're going to treat things differently when it comes to diseases? What do you think overall in terms of medicine we're going to do now because this hit us?
I think definitely there's going to be more changes because a lot of people are calling for policies regarding this. It's hard to say if that's going to be like, something, but definitely it will evolve to a point where we can say, something like this evolves in a community, we know what to do right away. as opposed to, it's spreading all over the world and creating this.
Yeah.
So on the policy front, there's a lot of everyone is talking about it.
I see those memes. The memes on Facebook. The one was like, "Whoever ate that damn bat, this is all your fault." But no, but I agree. But do you, I guess, futuristic type of thing? I think I talked to you once before about it, and it just came to my mind. CRISPR, how CRISPR might be like the future of medicine, genetic altering, because genetics is up and coming. It's modernly new type of thing that people are trying to play with. Do you think genetics is going to play a huge role in the medicine world in the next like 20, 30 years? Do you think we're like even antibiotics, we're going to, because their bacteria is becoming more resistant per se, right? And now our antibiotics are failing. Do you think we're going to rely more on genetically altering things as opposed to medications?
Regarding the COVID, I don't know how relevant
That would be.
That would be, because I don't see that. I mean, people are definitely working in different aspects, but the speed at which things can move is also not to the pace the virus is moving.
That is true.
And that's why there's a problem. So maybe there's going to be a lot of advancements. They're using artificial intelligence technology to design molecules and medications, but the contagiousness of the virus beats everything else.
I was going to say, no matter what, that thing's going to still infect a lot of hosts.
That's right.
My God. Okay. I guess, Dr. Sahadevan, what would your final remarks be? I guess like an overall viewing of what you kind of discussed. What do you think people should take home the most from this little Skype video we had?
The best is to stay safe, follow the guidelines, definitely follow your healthcare recommendations for that area. Like, New York has a different recommendation as opposed to where we are. And then, we'll expect things will cool down in about a month or so. Hopefully we reach that and, we are all able to go out and relax a little bit.
There you go.
And work-wise, we are better ready, hopefully.
So that's what I was going to ask you too, right before we log off, because you brought it up and I just forgot about it. But people are constantly putting on social media too, when this is all over, we're going to the club, we're going to the bar, we're going to this and that. Do you think when they announced we're like uplifting the, what we call it, the emergency lockdown, stuff like that, do you think that's a good idea for people to go right out, or should we take a little bit more time before?
That's going to be a recommendation, that comes for it's going to be different for each community. I can say that, but I cannot say that for a whole population. That would be a very hard question, because for New York, obviously there's so many cases,
right?
And I think they're going to lift restrictions sooner than most people would expect, as opposed to we don't have as much, so we are more likely to have more cases coming up.
Sure. Oh, here we go. All right. So pretty much don't buy 50 rolls of toilet paper, maybe buy like 25. That's okay. No. There we go. But Dr. Sahadevan, thank you so much. I appreciate your expertise. I'll probably see you back whenever I see you again, whenever we're both working at the same time. I appreciate you. Thank you very much for joining me on this episode and letting me torment you nonstop for almost 50 minutes. So awesome.
It's a pleasure. It's a pleasure, Brian, talking to you.
You have to say that, but once I stop recording, you can tell me what you really feel. So thank you, Dr. Sahadevan.
You're welcome again. Bye for now.